Let's finish up with the questions and answers from the brain and pain. You've reached Talking with Dr. Terry, 180 Seconds to a Better You, message number 513, and I'm Dr. Terry Wurzbacher. We're picking up from where we left off yesterday. Debbie also asked about fibromyalgia, which is essentially pain all over with no obvious tissue or structural damage found. And yes, this is considered a neuroplastic condition. It's associated with increased rates of childhood trauma and adversity, and people with fibromyalgia tend to have other neuroplastic conditions. Fibromyalgia has had a rough go of it. It was a wastebasket term initially because there was no cause found, and doctors are skeptical when no structural or tissue damage is found. Medicine is like the Titanic. It only sees the tip of the iceberg and ignores the massive underpinning of that iceberg, and that's what's affecting so many of their patients. But the pain and other symptoms with fibromyalgia are real. They're not faking or imagining it. Terry also asked if I was going to talk about emotional pain or just physical pain, and she wanted to know if you could unlearn your emotional pain. This is a great question and kind of took me back a little. They're so closely related in the brain. I've been just talking about pain and how emotions affect that pain. I'm not a psychiatrist or therapist, so I can't really get into how you treat the emotional pain, but I can tell you from personal experience that IFS has done wonders for me in that regard. When you think of the emotion as coming from a little child part inside you, it's much easier to have compassion and understanding, and often that's what opens the door to help you unlearn it. There have been studies that show that the brain areas that control physical and emotional pain are adjacent. They've shown that many reactions to physical pain light up the emotional pain areas in the brain. They're all intertwined. Some of your emotional reactions can be unlearned with work, but you don't want to unlearn or uninstall your emotions. That's part of being human. You just want to learn better ways of expressing them, and I hope that helps. Susan had a great comment. She said that it seemed that the guy who reacted to the helicopter was reacting to the sound, not just a memory. If you look at it as the sound triggering activation of the pain's old neural circuit from his leg injury, then that's correct. There are many triggers for pain. Dr. Schubiner talks about how his wife has a piece of apple every day for breakfast. One morning she brought it to him in bed. The room was still dark, and when he bit down, he thought she was poisoning him because it tasted soft, and he immediately thought the apple was rotten. Well, that morning she decided to use a peach instead. She hadn't told him that, though. His brain was used to having an apple, so when she put it in his mouth, his brain predicted it would taste like an apple, and when it wasn't, it sensed danger, and he reacted accordingly. Ugh, it's rotten. I think that's what's happening with the helicopter sound. The brain predicted the pain response when he heard the chopper, and Susan said it's like Pavlov's dogs, and that's exactly right. Have a diamond day, everybody.